Good evening, everybody, and welcome to our YW Mission Moves Gym City Earth Tones. We welcome you all who are here in person live with us at the Gym City Market. YWCA Dayton is so happy to be here, so happy to be having community dialogue. This day particularly is our Mom Voice Maternal Healthcare session where we are focusing on those disparities of healthcare, particularly in our communities of women, our communities of female identifying people, especially those who have been through maternity, who have the intersectionality of not only being female identifying, but also being women of color, looking at mental health and mental health conditions and physical disorders and physical conditions that relate to motherhood. And so we're very, very excited about this event today. Today we have some very special people on deck who will be participating and who will be speaking to you today. I'm very excited about that, and we are looking forward to having a very, very, very strong conversation that allows us to really look into the depths of what's happening in our community and how we can be a part of the change that we want to see. I'm your host today. My name is Taylor Curtis. Some of you may know me as the youngest Black female to achieve tenure in any higher education institution in the history of the United States of America. Some of you may know me as your psychology professor or a singer in the community. But I left that tenured position to work directly in the community, in the heart of the space where we are able to eliminate racism and empower women. And so I left for the YWCA Dayton, where we have a mission that's dedicated to eliminating racism, empowering women, and promoting peace, justice, freedom, and dignity for all. And I'm so grateful that we can do that right here at Gym City Market by talking about how some of the issues that we experience in our community affect our people and how we can bring about change in a way that's very, very necessary, especially right here in the Montgomery County area. When we look at the history of maternal health care, we don't see the nicest things that have existed over the past. When we look at our history of maternal health care, really we go back to the times of slavery. During the slave trade, individuals who were enslaved were often used for medical experiments. These individuals were the ones who had the first surgeries, the first C-sections, the first maternal and reproductive surgeries, hysterectomies, and things of that nature. If you read the book Medical Apartheid by Harriet Washington, she goes into a lot of detail about this history of malpractice and discrimination that shows up in ethnic communities here in the United States of America over our history. The very person who was kind of celebrated in this country as the father of modern gynecology, J. Marion Sims, was actually one who did all of his experiments and all of the things that he discovered on enslaved individuals without their consent. This man had about 3 months of training and 2 dead patients prior to him actively engaging in this work. And he was doing this without any consent. This same person was known for prying open the skulls of children with a shoemaker's tool for the sake of helping children of color's brains have more space to grow, because he believed that their intelligence was limited by their skull size. When we look at other aspects, especially in the area of reproductive health care, we can think about people like Henrietta Lacks. That was a Black woman who was dealing with a cervical tumor, and the cells that were cut from her cervical tumor were known as HeLa cells, and currently right now they have been used for chemo, they have used for polio vaccine, for cloning, for gene mapping, for in vitro fertilization. And her research, that research from her cells, helped us learn a lot about the genes that cause cancer and how to suppress cancer, and it's been used in developing drugs for herpes and leukemia, the flu, hemophilia, Parkinson's disease. And in all of that, that woman was never properly taken care of, and her dignity did not exist. And so we can thank that woman for her contributions to science and to society, yet often in their life and in their actual walk and their experience, these women go without dignity. They go without being treated properly. When we look at the history of medicine in the United States, we see other areas where there's been exploitation, where there's been harm done. We look at the Tuskegee Experiment that started in 1932 up into 1972, during 40 years, where men who had sexually transmitted diseases, specifically syphilis, were being watched. They weren't being helped or aided. They were just being watched as we watched their bodies be operated or not even operated on, but looked at as we watched them have spinal taps done to remove their cells. And as they were going through the different stages of death, basically through syphilis, they were being watched, not treated, even though the cure was discovered in 1947. Before the cure was discovered in 1946, from 1946 to 1948, 700 men and women in Guatemala were injected with syphilis by the United States government. These were prisoners and soldiers. And so when we talk about the history of oppression and when we talk about how racism shows up in medicinal history, we see that it was there. And then we see that things have started to get better. We've seen that there have been some changes. We've seen that there has been speaking out for the rights of people, speaking out for the rights, speaking out for people to have advocacy, to be able to have a voice, to be able to say that they need help and to be able to address their needs. Yet we still see disparities, especially in the space of moms. When we talk about moms, that's a very special category. You're talking about a group of people who not only have to experience the hardships of life, which may include their socioeconomic status, may include their religion, may include the political affiliation that they're connected to or other things, but then you see that there's a whole other level when you talk about being a female identifying person. There are certain aspects of the biology of being a female identifying person that makes life incredibly difficult depending upon your different conditions. You're talking about women with everything from their basic experience of being a female identifying biological female to looking at PCOS, endometriosis, having ovary tumors like fibroid tumors, finding cancer and cervical cancer, and many, many other things that could contribute to their experience. And then add on the responsibility of taking care of a child, and then add on the needs of that child and the needs of the household, and then add on a ton of stress about how you're going to raise a child in this crazy world. And then imagine what that might do for someone who might already have an existing mental health condition. So when we talk about moms and mom voice, the voices are very different. There's no monolithic mom, yet we all can say that they all go through a lot of similar struggles when it comes to raising children and going through the maternity process. So today we have somebody with us who actually walks with moms from before birth, through birth, and afterwards on their journey through maternity. And that person with us today is Malika James. Malika James, you can clap for her. Malika James is a community change agent. She's a maternal and child health leader in the Dayton area. She's a proud wife and a mother of two. She's passionate about bringing policy change and change to our systems because that impacts our Black maternal and child health. Professionally, Malika has strengthened the community by developing and previously leading a task force that was aimed at eliminating the disparities in birth outcomes and providing a unified response to the infant mortality crisis. And Malika's path to becoming a doula was inspired after having her own support for labor and the birth of her daughter in 2016 and again for her son in 2018. These transformative experiences, among others, was the springboard for her to start Nurturing Seeds Doula LLC. And as the CEO and founder, Malika provides pregnancy, labor, birth, and postpartum doula care to women and families. With aspirations to become an obstetrician gynecologist, Malika's mission is to bridge the gap between doulas and physicians by becoming one. Welcome, Malika.
Thank you so much, Taylor.
Thank you for being here, girl. I'm so glad to see you and hear your experience because you have a totally different perception of moms and the experience of moms because you have a hands-on experience like no other. I think a lot of us can probably say, whether we've had children or not, that we probably know someone who has. We might have been able to walk that situation a little bit, maybe walk in the hold their hands a little bit through that process, but you hold their hands through the entire process. So I want to know a little bit more about your experience as a doula. For those who are unaware, please share with us, what is a doula? What does a doula do?
Sure. So again, thank you for having me here. It's just a pleasure to talk about something that is so very near and dear to my heart. But doula, a lot of people don't know what a doula is. And it wasn't until 2016 that I found out what a doula was. Actually, 2015. Nakia Smith was my doula for both of my children. And a doula is someone who really is a servant to the mom. That's literally what it means, mom servant. And it's someone who can provide that emotional support, like you mentioned, be able to walk you through while you're while you're pregnant, during the labor process, birth, and then postpartum. So someone really to be there to help you understand, help you plan for your birth, but to ultimately be there to help provide you with all the care that you need.
Okay. So in your experience, what are some of the things that women struggle with in maternity and why they might need that additional assistance of a doula?
Whew. I'm just thinking back to my own personal experience of being pregnant, right? And so I thought I knew it all. I thought that because I was an auntie, that I knew what it would be like to care for a child. And I'm a planner by heart. I always have my notebook everywhere. So when I went to the doctor, I had all my notes and everything down. But I think having a doula was that added bonus that you didn't know that you needed until they were there. So my doula met with me frequently before I had my child. And the first thing that we did was talk about what my birth plan was going to be. Remember, I said I was a planner, but I didn't have a plan for birth. I didn't even know that you needed to have a plan. And so we literally wrote down, who's going to be your cheerleading team when you get into the room. So literally listed out, I need my mom there. I need who's now my husband there. I need my sister. I need my mother-in-law. I need this crew there to be able to cheerlead me when I need to build my confidence up when I'm having this child because I wanted an unmedicated birth, and to list out all my preferences from I want to breastfeed. As soon as the baby comes out, I want to have skin to skin contact on the breastfeed. To aftercare, everything listed out. If you wanted to keep your placenta, having that plan ironed out before you went into that room was all that mattered. And so having that to share with my midwife early on was key, because you don't want to just come in and say, this is what I'm doing or this is what I'm not going to do. You really want to have that relationship with your medical provider to say, this is what we need to do. When we get here, this is what I agree upon. And so I think that was a huge part for me to have her there, and to really advocate for me. This is a new experience for me. She had children before, and she knew what it was like being in that room and all the chaos and everything that I needed to calm me down. So she would, massage me when I needed. My leg was cramping up. I needed a massage, and then I said, "Nope, move." So she moved out of the way, and so just that comforting piece that I needed. There was also an experience when, after I had my child, there were certain things that I did want to happen and certain things that I did not want to happen. And I questioned myself because my medical provider said, this is what you really need to do. And I wasn't confident in my decision making at that point. So I called my doula and I said, hey, this is what I'm being told I have to do, but this is what I really want to do. This is what me and Chris decided that we wanted to do. What do I need to do? She said, Malika, you did all your research. Trust yourself. You got it. And I felt empowered. I felt encouraged to really stick to my guns and stick to what I knew was right for my child. And it was able to do that. And so confidently was able to do that. So
I think that's a huge point, because I think a lot of times we may not know what to ask for or what to say, especially in a medical situation. If you've never, studied medicine or learned the language or really engaged in medicinal work, you probably don't even know what I should do, what I shouldn't do. Should I just do everything that the provider is telling me to do? Do I have choices? What are my choices, and what does that look like?
Yeah.
How does a doula, for yourself, when you work with other women, how much does that matter for women's experience in maternity?
It matters. It's one of the most important things to really have your own voice, first of all, but being taken seriously when you're in that room. But really, I think it's about building the confidence of that mom and the partner. So whether if it's the same sex or whether it's the male support, making sure the entire family unit is encouraged and has the confidence to be able to stick to their grounds and what they want to have.
Yeah.
So that was super important for me as a mom, being empowered to utilize my own voice, but having those conversations early on with clients to say, if this is what you want to do, then that's fine. And giving them the room to, make that decision for themselves. And if they decide to go against their own decision, then that's fine. But as long as it's that mom's or that family's decision, that's what it matters.
Yeah. I think having a decision matters. Knowing that you have a decision, right? I don't think a lot of people know they have a decision. I think, you hear information and you're like, oh, this is what has to happen. And then that's what you do. And then you move in that grain, and you never really asking questions, never really doing a lot of research. So when it comes to your experiences with other mothers, what do you think are some of the challenges, especially for maybe women of color or women of low socioeconomic status, or women with some of these physical and mental health conditions? Like, what are some of the main things that you see show up as issues?
A lot of issues that come about. I think one of the biggest things, just in maternal healthcare, is just their entire health overall. And so I even try to go back and to encourage people in general, before you even have a baby, before you even get pregnant, the importance of your own health. And so making sure you're having healthy eating habits, making sure that you're having all the, lowering your stress, everything of that nature, so that you can be in the best position to have your child. I think for the women that I've seen, personally as a doula, but also just women in general, that voice, having that voice and being taken seriously when you're in that room with your medical provider has been a tough thing. And so you think about Black and brown women, and race and racism, how that has an impact on you when you're in the medical, when you're at the hospital or with your medical provider, and how that impacts everything. And so I think the biggest thing for that is to equip women with, these are the things that are important for you to talk about early on with your medical provider.
Yeah.
And if you're not getting the care that you need, you're able to go elsewhere to get what you need. You know what I mean? And so I often meet with my clients after they have their medical appointment, and we talk about, what did you talk about? What are some things that you may have questions about, so that when you go back, this is what you can talk about.
Yeah.
So it's just that cyclical, that repeat, that education, that affirming, but giving them some tools so they can have when they go back into it.
Those tools are so important, because I can already see in my mind, the stereotypes that come up about women of color. Oh, she's loud, or she's angry, or something like that, right? And I can only imagine in pregnancy, if you're going through, your physical changes, your hormonal changes, pain and suffering, let's be honest. There are some things that are difficult about it. And in that space, I can only imagine how trying to vocalize what you need, or trying to ask questions, or even presenting any type of pushback to what you're being told could be easily taken into that stereotype and turned into, neglect. or not being treated properly or not being heard or discrimination of some sort. The idea that, you know, people have to have a conversation to say, okay, how did that go? How do I feel? You know, how did I feel that do I feel like I was heard? Do I feel like I was listened to? That whole thing is a process. And I understand that process very well. And I personally have had to change providers because the provider absolutely didn't hear me. And I had gone through significant issues for 7 years seeing this provider, and the provider just was not hearing me. And upon my first appointment with the new provider, I was immediately scheduled for surgery in the next couple of months and found out that I had stage 4 endometriosis, which could render you infertile in some cases. And so going through that process just let me know, like, even though I thought I had a voice. I thought that I was an advocate. I thought that I could vocalize what I needed. And when I said, no, I really want an ultrasound, or no, I really want you to check on this, I thought that that was enough. But because I don't have the medical knowledge of what I needed, I didn't know what to ask for. And so I could only say the things I knew. I know my family history, which I didn't know extensively, which people don't know extensively, especially in communities of color. I feel like in communities of color, a common practice is to maintain a secretive nature of negative things that are happening, especially physical conditions and things like that. It's like nobody's business. You keep it to yourself, keep it in the house, that kind of thing. And so I didn't know that some of my aunts and great aunts and other people had this condition. I only knew my mother did. But when you find out how extensive it is in your family history, if you knew that ahead of time, there are things you could do to, raise more awareness. And there's just a lot of things in that experience where I was just like completely clueless. Like I thought that this was like, oh, you have this little issue, have some kids, have a hysterectomy, it'll go away. Like that's not the case.
Just sweep it under.
It doesn't get swept under the rug. And to know that it's, likened to cancer in a sense of how it can spread throughout the body and attack different organs. Like these are things that people don't know, but 1 in 10 women have this condition.
Yeah.
And in the Black community and the BIPOC community, that number is even higher. So we don't talk about some of these things and have that knowledge. And so I think that's so critical. Like you said, to be able to have a voice, you have to know what you're saying. It's like to be able to have a voice, you have to be able to speak a language. You have to be able to speak the language in order to be understood. And so having a doula can definitely be useful in that process and in that experience. I feel like also you mentioned that sometimes there are some issues due to, where they sit socioeconomically and how they are even able to have access to the right things. Like you mentioned, being healthy and eating the right foods just to get your body into a place of being healthy before you even have children. And I'm thinking about the food insecurities,
right?
And how we have a food desert right here in the Dayton community, right, which is why Gem City Market exists. It was created for the sake of building the community and bridging that gap to provide quality foods, healthy foods, to provide vegetables and produce and things that are not that quick fix, convenient style that tends to have all the things that are bad for you in it. And so I can only imagine how much more elevated the issues in the maternity journey could be if you are both in that lower socioeconomic status and maybe have those stereotypes up against you and possibly dealing with additional issues. When it comes to how there's access to maternal health resources, how accessible is that for people? Do you think that it is more difficult? Do you see people not having the resources they need, the insurance they need? How does that look from your lens?
It's a great question. It's all encompassing, right? So you think about, as you mentioned, right here in Dayton, we're sitting in a food desert. And so women in this particular area may not have the access to get to a grocery store or to get to a medical provider. And so that just only makes things harder. But also think about where they're living. So if they don't even have the basic necessities, they're not even thinking about their maternal care. They're thinking about survival. They're thinking about where they're going to live first. They're thinking about where they're going to get their next meal. And if they have other children, how are they going to feed their kids? And so oftentimes their own health care sits in the back burner. There are a lot of resources here in the Dayton area, but do people know about them? Do people access them? Do people talk about it? I think that's the benefit of having a doula that can be able to share what those community resources are. I'm even thinking of WIC. WIC is a resource that a lot of people may not even know they qualify for, and so tapping into these resources that have been here for a long time are something that I'm hoping our moms can take more advantage of, not just the mom, but even thinking about the father. Yeah. That supportive piece as well. So there are a lot of resources out here for not just the mom, but the father as well.
Why do you think people aren't accessing the resources that exist? Why do you think that they don't know about? Do you think that they're like oblivious to it, or do you think that they assume it's for someone else, or they're just so caught up with life that they're just unaware?
I think it's caught up with life. Again, they're caught up with the day-to-day, the survival. A lot of people are caught up in survival. How am I going to get my next meal? How am I going to take care of the children that I already have? Do I have enough money to pay my rent or my mortgage? Do I have enough money to do anything else? May not even be thinking about healthcare. There may be individuals that are on Medicaid that can be part of or have access to a lot of resources. But again, if they are working a job that doesn't allow them to get off to do these certain things, are they going to do that? So there's a lot that falls into play. And even thinking about somebody who does have a decent wage, you may be in a leadership position to where you can't really take off. Or you may not have that added support if you, again, have other children or people that you're caring for to say, am I going to take off work? Am I going to pull this person out of school? Do I have transportation to get there? Do I have somebody to watch my kids? Do I have, all these different things that are part of that decision-making process when it could just be easy to take off and go to the doctor? It's not that easy.
It's not that easy. And I don't think people I don't even think providers understand, when you have these short windows of time that you can come to an appointment, or these short windows of time that you can access certain resources. I'm thinking of a resource center where I knew someone who worked there who had to vocalize and say, hello, we need to change our hours. This doesn't make sense. How are people supposed to get here to the resources if we close before, you
get off
this time, before they get off of work, especially if we're trying to get to under-resourced people, then we're probably going to need to be very creative about how we open ourselves up and outreach for that, so that we have, the flexibility to meet their needs in the way that's necessary. But that's why these conversations are important. The more that you realize that you knowing something, you having the knowledge, you having the understanding gives you a voice to advocate for someone else, then you can be that person to say, hey, this doesn't make sense. We need to have a different time that we operate our hours. Like, that's the conversation. That's the piece. That's where you come in. Like, whether you are in maternity or not, you have the opportunity to utilize your voice, your space, wherever you hold space, to be able to say, hey, there are some things you should be aware of. Here are some resources you should know about. Or, have you ever considered getting a doula so that someone can walk you through the process and help you understand the things that may not be common knowledge? And so I think the work that you're doing is incredible. And I appreciate the fact that you are willing to draw on your own experiences to be able to see other people where they are. And I think sometimes if we haven't had the same experience, or if we've had a pleasant experience, or maybe our experience just was a while ago, it's easy for us to lose sight of what that feels like and what it's like to be in the space and to need that support and to need that help. And so the work that you're doing is phenomenal, and so we're so grateful that you're here with us today, and we look forward to hearing more from you when we have our panel discussion in a little bit. And at this time, you all, we are very excited to introduce our next guest. We have our wonderful and amazing Associate Director of the Center for Survivors of Sexual Violence at YWCA Dayton. Her name is Amy Dudley, and we're happy to have her here. What's very exciting about her is that she is a mother, so she has the experience, not only the experience of having biological children, but also the experience of raising bonus children. And so that's a very comprehensive experience as a mom, because there are different walks and roles that we all play. She's a survivor of domestic violence. She's going to share with you some of her experiences and a little bit more about herself. But what I think is very, very prominent is that she really specializes in motivational interviewing and cognitive behavioral therapy and crisis intervention. So she's constantly working with individuals who are in crisis. And as you work with individuals in crisis, you get a lot of experiences about seeing the impact that has on mental health. And at this point, mental health is something that we have not talked about as much as we have in the past year, I believe, with the pandemic. Now the conversation of mental health is one that's more normalized. Now people are saying, take care of yourself, put your oxygen mask on first. And now we're starting to acknowledge that mental health issues exist in our community and in our houses and our day-to-day experiences, and that's okay. But I think it's even more important to understand how that impacts the person holistically, especially as they walk through motherhood. So welcome, Amy Dudley.
Hello, everybody. Thank you so much for having me, Taylor.
We're so glad to have you. And we're going to share the screen because Amy has a wonderful PowerPoint that she is going to show. And so we're excited to have that.
Okay. Hello, everybody. My name is Amy Dudley, and like Taylor said, I'm the Associate Director for the Center of Survivors for Sexual Violence with YWCA Dayton. I am also a mom to 4 biological children and 2 bonus daughters. When I set forth the goals for my life after graduating high school, being a mom was not on the top priority list for me. I had dreams of being a lawyer, the next Ruth Bader Ginsburg. I had big, big dreams. And then I became a mom. And I am a mom. Let me tell you, I love being a mom. When I hear people say having a child is like watching your heart walk around outside of your body, that defines me to my core. These 2 pictures here are 2 very different times in my life. Behind these smiles that I was asked to give for these photos was a mom who was struggling with paralyzing anxiety and post-traumatic stress syndrome, or as most people call it, PTSD. The picture on the left, I was sitting next to my abuser, a man who verbally, physically, and psychologically abused me for 3 years. I imagined not being alive anymore so many times. I wasn't sure if it would be his hands or my own. I was so exhausted I didn't care. Sitting on my lap is my oldest son now. He was about 4 months old at the time. I was 20 years old, just a baby who had had a baby. I was terrified and trapped, and my mental health was extremely high risk. The picture on the right is 3 days after I gave birth to my 3rd son. After a very easy pregnancy with 0 complications, he was born premature at 8 pounds, 10 ounces with lungs that had not fully developed. He was not expected to make it out of the hospital. I blamed myself. I didn't speak. I didn't cry. I didn't eat. I wasn't sleeping. I wandered the halls of the hospital like a zombie waiting for my child to pass away. In both of these pictures, I was with doctors, nurses, pediatricians, specialists, you name it. The first year of a baby's life is back-to-back doctor's appointments, immunizations, wellness checks. While my youngest son was in the NICU, I was there from the moment they allowed me in the morning until they kicked me out every single night. Not once, not one single time was I ever asked how I was doing. Both of my situations in these pictures here were very extreme, and still I was never asked how I was doing, how I was feeling, or if I was okay. My abuser was observably controlling, attending every appointment with me, not allowing me to speak. My anxiety was extreme, observable, nothing. My son was surrounded by specialists, doctors, nurses, having conversations hourly with me. I hadn't even had the opportunity to hold my child from the moment he was born. There was no bonding, there was no skin to skin, there was none of that. For 13 days, I was not able to touch my child. The picture here, as you see, I was leaning in near to him. That was the closest I was allowed to be near my boy. Again, not one doctor, nurse, no one thinking that my mental health was important. Not only have I realized the damage this did to my mental health in the long term to never receive that care or support, but understanding how the lingering mental health issues affected all of my children, even my biological children that are not in these pictures. It's affected them in some capacity, and it's been very devastating for me to comprehend and understand that my lack of care and support has carried through all of my children. This was well over 20 years ago. If my mental health as a mother was not important in these situations that I described above, what happens to new moms who have a wonderful labor and beautiful babies that are born, beautiful birth experiences, new moms who have supportive partners and beautiful new babies, but are also experiencing depression or crippling anxiety that they do not understand. I was privileged enough to have good health insurance and a support system in place when I was ready to lean on that. But we all know, and we've heard just today, this is not the case for minority populations or for low-income families. In some of the research that I was doing, I came across a few poll questions that I was actually shocked at some of the answers. So if you would participate, you can drop it in a chat if there's the option, or if anybody wants to answer. Maternal mortality in the U.S. is higher than any other developed country, and roughly 60% of these deaths are preventable. True or false? True. That answer is true, yes. According to the CDC, Black mothers are 2 times more likely than white moms to die from complications during pregnancy or childbirth. True or false? That actually is false. Black mothers are 3 to 4 times more likely than white moms to die. Postpartum blues happen to most mothers and usually last just as long as postpartum depression. True or false? False. Postpartum blues happen to 85% of new moms, will only last about 2 weeks. What percentage of Black mothers suffer from postpartum depression? 10%, 20%, 40%, 60%, or 80%? 40%. Close to 40% of Black mothers will suffer from postpartum depression, which is more than double the rate of the general population. So some other facts that I came across that were alarming to me, especially looking back on my own mental health crises when I was having babies. Did you know self-harm is the second leading cause of death for new moms? The second. It's a leading cause, but it's not only a leading cause, it's the second leading cause for death of new moms. Wow. Suicide attempts among pregnant and postpartum moms have nearly tripled in the last decade. Stigma is the biggest barrier for women in disclosing their postpartum mood symptoms. The stigma of the shame, the embarrassment, the why aren't you happy you have a perfect baby, all the stigma. And the unacceptable disparities that persist among maternal deaths because of systemic racism. Maternal death by suicide. Why aren't more people talking about this? Maternal deaths by suicide are an unrecognizable but preventable public health issue. Suicide deaths are a leading cause of maternal mortality in the U.S. It is a public health crisis that has gone silently worse. A new study has found that suicide attempts during pregnancy and after childbirth are increasing, nearly tripling over the last decade. Nearly 24,000 individuals are at risk for suicide. Suicide is already among the leading causes of death among new mothers in pregnancy post-delivery, are considered risky times if they already have depressive symptoms. And maternal suicidality overall increased from 0.2% to 0.6%, with the greatest increases seen in Black, low-income, younger individuals, and people with comorbid anxiety, depression, or other serious mental illness. So who is at the most risk? Women who die by suicide regularly have comorbid disorders. Depression was the most common, found at 68.5%. That's huge number. Anxiety and bipolar disorder are also very common. Women with fewer financial means are at most risk for developing postpartum depressive symptoms. A woman without the village that it takes and the means it takes to raise a child may feel increasingly overwhelmed and isolated, which is a common thought among many people who are considering suicide. Even women who have had to go back to work experience some form of isolation. If they're stressed about making ends meet and they're surrounded by people, they still might not be connecting to other people like they need to for that support. So what are some of the warning signs and reasons you would think for postpartum suicide? I mean, just look at some of these. Some of these just look like symptoms of a new mom: fatigue, sleep deprivation, stress, anxiety, irritability. And some of the other ones that stand out: feelings of emptiness, inability to find joy or lack of emotion, constant crying, extreme emotions one way or the other. Some of the reasons for considering suicide with somebody experiencing postpartum depression are simple: fear of failure, societal pressure to be the perfect mom, comorbid mental health issues, being sad or embarrassed or ashamed, lack of a support system, and then again, disparities in healthcare. So these are just some facts and statistics for postpartum depression with women of color. So CDC says that postpartum depression affects over 11% of women overall in the United States, which is 1 in 9 women. 1 in 9. Factors such as the person's socioeconomic background, their race, profoundly impacts the likelihood of developing the condition, and then also the likelihood of receiving the care and treatment that they need. They'll avoid it. Black women were more than twice as likely to experience postpartum depressive symptoms as a white woman. The risk for Latina women was also almost twice as high. Research suggests also that as many as 50% of women with postpartum depression do not report it to their medical providers. They don't report it to their husbands, their partners, their family. They live with it. It overwhelms them. Evidence further suggests that Black women may avoid talking about their depression due to feelings of embarrassment, shame, and fear of the discriminatory attitude due to racial stigma. Women of color are also at a higher risk of experiencing postpartum depression than white women and less likely to receive the care they need. And finally, Black women were 57% less likely to start treatment for postpartum depression, and Latinas 41% less likely than a white woman.
That's crazy.
The numbers were astounding.
It's absolutely astounding. It's a shame that this is what the numbers look like, but it's even more a shame that we don't hear this very often.
Yes.
You don't hear it very often. You don't talk about it very often. It's not something that tends to be shared the way that it should be.
Yeah.
And it's just unfortunate that it's not, because it should be. It really should.
Well, what was surprising to me was this next piece of information. We go to it's a little quote here. So, for infants to thrive, mothers must thrive too, physically, emotionally, and mentally. Too often, all the focus is only on the needs of the newborn, which are, of course, of vital importance. But don't forget, when a baby is born, so is a mother. So what can be done? What can we do? So on average, a woman will visit a healthcare provider 25 times in the 2-year time frame from conception to their child's first birthday. Healthcare providers who work with childbearing women should be prepared to discuss and screen for mental health issues. OBGYNs and midwife providers and their staff nursing staff, health professionals such as doulas and lactation consultants. Medical professionals working in the emergency room should be trained, as the majority of new mothers who die by suicide, this one really got me. Mothers who die by suicide visit an ER within 1 month prior to taking their own lives. That one really sank in. Starting these conversations early in pregnancy, not after the baby's born, early in pregnancy normalizes that healthy conversation and the importance of mental health in developing trust between a woman and her obstetrician, which can later help her feel more comfortable when she needs to speak out and seek the care that she needs later if she's feeling anxious or depressed. So this was another somewhat alarming bit of research that I came across. So maternal depression screening by state. We are not very far in this at all, and Ohio is not leading the charge, unfortunately. I'd like to say that we are, but so there are, let's see, in 2016, the Centers for Medicare and Medicaid issued a bulletin that enabled state Medicaid agencies to cover maternal depression screening as part of well child visits. As of February 2020, 43 states, including Washington, D.C., allow, recommend, or require maternal depression screening during well child visits that are actually covered by Medicaid. I don't know that providers know this. I know yes, it's Medicaid billable. They should be all over that, right? So currently, 12 states allow screening for maternal depression. 12 allow. 25 recommend it. 6 states require screening for maternal depression. 6 states. 6, that's it. And 8 states do not even have an active maternal depression screening policy in place at all. So there's either they allow it, they recommend it, they require it, or some just don't even consider it at all. The 6 states with the policy identified since 2018 are Louisiana, Missouri, Oklahoma, Oregon, Utah, and Wyoming.
Wow.
Yeah.
We're even close.
Yeah. So how can you help prevent maternal suicide? Medical professionals are not the only ones who need to reach out to pregnant women and new moms. It's something we all should be doing. Ask your pregnant friend how she's feeling. Ask the new mom in your life how she's doing. Watch for signs. Watch for red flags in their behavior. As a new mom, advocate for yourself, like we talked about a little bit ago. Understand your mental health greatly impacts your new baby's mental and physical health long term. It's so, so important. Suicide can be prevented, and prevention starts by asking with compassion, listening with empathy, and being ready to step up to help when someone's in need. And lastly, if you or someone you know is experiencing thoughts of suicide or in a mental health crisis, please call one of these 2 numbers. YWCA Dayton's a 24/7 crisis hotline, and there's also the National Suicide Prevention Hotline. Your confidential call goes to the nearest crisis center. They'll talk about more than just suicide. They cover lots of issues and will help put you in touch with a location near you that provides crisis counseling as well as mental health referrals.
Wow, that's a lot of information, and with a lot of information, a lot of good information that can be used, information that's very, very important. If you look down below us, you'll see that crisis hotline there. Please make sure that you save it in your phone, share it with a friend, make sure other people are aware. I think it's very important that as we talk about this, and we're going to bring Malika back. Come on in, Malika. We're going to bring Malika back and talk about this just a little bit more as we talk about what it looks like to make sure that the mom voice is heard, and to make sure that the mom voice is heard right. And so in our last 10 minutes, and we're going to take some time also to, of course, address any questions. So if you have any questions, please drop them in the comments. We would love to include any information that you want to know or that you specifically have more questions about. We would love to address that. But I guess some of the questions that I will follow up with, basically coupling with what the 2 of you have talked about, I think it was really interesting how you mentioned that postpartum often shows a lot of signs that just look like normal pregnancy, or normal motherhood,
Yes.
and normal, I just have a brand new baby and I'm going a little crazy type of feeling, right? So when you've seen postpartum in your experiences, what are some of those indicators that are significantly like, okay, something's wrong?
Not
Like,
just the normal.
yeah,
fatigue,
yeah.
the
Yeah.
normal sleep
What's the red,
deprivation.
like, I know you mentioned some red flags, but can we talk a little bit about what that looks like? How might that present for somebody?
I think what she mentioned about, the whole 2 week period, like lasting longer than that, but also this whole idea of you feeling so down that you're not the best mom and repeating that over and over and over again. Someone just totally tearing themselves down is when you get a huge red flag and you need to make sure that you get that person some help. I haven't seen it in the clients that I've had so far, but
because they've had your support.
yeah,
Right.
well, I'm hoping.
Yeah.
But I've seen it in a lot of people, just in general. Friends that you've talked with, um, anybody that you talk with, that repeated, constant downing themselves. And I think that's just within suicide
Yeah.
altogether,
Yeah.
not just when you're having a baby. That person thinking that they're worthless, they don't offer anything. And so it's so difficult to really pick up the signs.
Yeah,
It's so difficult with that.
I have a question. So when you are working with a client, do you ask about mental health prior to being pregnant? Like, is that something that's incorporated into the care when you are working with them?
See, when I get the moms, they're already pregnant,
Mhm.
but just in my whole career, I've talked a lot about the importance of just being your healthy self, whole self, before you even become pregnant. So that comes out. The challenges with maternal depression screening is that it's not all culturally competent, and some of the questions aren't geared towards women of color as well. And so having some assessments that are more culturally appropriate are needed in Ohio, in the county overall. But it comes up, it shows up all the time. And so just being real attentive when you're having conversations with moms, be attentive to the changes and the signs that you see, and calling that out and then providing those resources for help, as you mentioned before.
That's a great question. We have another question from the audience. Thank you, Cedar. From Malika James, CEO. Can you talk a little bit more about your experience as a doula or as having one, bridging that gap between the doctor and the mom?
Wow. That's a huge piece. COVID has put a damper on a lot of things to where that relationship has been impacted because you can go in the hospital because of COVID right now. But I can just speak to my own experience of having a doula, inviting that doula with you into those appointments. I think that's key, but also providing that that birth plan ahead of time can help really bridge that gap and to really talk about how we are all part of this healthcare team. I think that's the biggest part, because at times what I've heard from different people in the community is that it's that strained relationship between the physician and the doula for whatever reason. And it's like, we are all here to support this mom and this baby. We're on the same team. And so I think, a lot of it comes with, as a doula, we are not medically trained. We don't have MD after our name. We don't have, NP after our name, but we are providing the support for this mom. And so having those conversations early on to let the physician or the midwife know that this is my care team. This is my preference, is to have this doula with me by my side.
Follow-up question: did that influence your desire then to want to be medically trained and be a doula? Is that why you went that route? Is that what your goal is when you have your OBGYN services? You plan to do kind of that comprehensive, holistic?
That is the goal. So I've always wanted to be a physician since I was a baby. I wanted to actually be a pediatrician, and working into the maternal and child health field. I've recently wanted to become an OB. But having the doula and understanding how impactful that was for me really solidified my decision to become a doula and to be medically trained as well. And so I think I really want to be that vessel to show that you can do both.
Yeah.
A lot of times, the typical pathway is for a doula to become a midwife, and I think midwives are awesome. I just so happen to want to be an OBGYN,
Okay.
and I really want to bridge that gap to bring those relationships together because it's all necessary for that mom.
That's a great question because I was going to ask that next. The difference between doula and midwife.
Yeah, I wasn't sure if I knew that one.
Yeah, midwives actually they're medically trained. They go to school for years. They're nurses, and they deliver babies. They actually deliver the baby. And so I was fortunate enough to have a doula and a midwife for both kids, and everybody was on the same team. It worked out perfectly. But the training, the different, the trainings and the principles are. So the principles are similar. The principles are similar. Not the training is a little bit different.
So there's another question in the chat for Malika. What are things you suggest looking for when searching for a doula? Where do you start?
Yeah, so searching for a doula, a lot of it is word of mouth. I wish there was like a clear database where you can say search a doula and find, but really it's word of mouth and finding women that you know that have had a doula and sharing those experiences to see would this doula work for you. I think the important piece when you do find a doula is to do an interview. I had someone who said, hey, I know you, but I want to do an interview. And we had a conversation at their house and just talked it out. And they were like, yep, I want to work with you. And so having someone that's down to earth, having someone that knows what they're talking about, first of all, someone that you know really has your back and really is paying attention to you, and that authentic relationship is key. And yeah, the same way that you would do an interview if you're interviewing for a job is the same way you should approach a doula and they're interviewing for a job.
It's like daycare for your child.
Absolutely.
Yeah, it's one of the most important pieces of your life. You want the right people on your team.
Yeah,
absolutely.
And I think the understanding that you have choice is so big, right?
Yes.
If you know that you have a choice in your doctor, you have a choice in midwife, you have a choice in doula, you have a choice in where you allow care to come from and who's going to be in that space. And just knowing that you have a choice and then knowing that you can do the research to make a good choice. Yeah. I will never, ever, ever tell anybody to do anything other than talk to someone who's experienced that person. Because it's so much, right? Like you can say, oh, they're nice, they're really cool, and they're great. But if you've never experienced
make sure that vibe,
and if you've never experienced their care, who they are as a person and the care that they offer are two different things. And so my provider that did not listen to me was recommended by a lot of people who were recommending me because that name was popular, because a lot of people in the community knew this person, because a lot of people go there. But then years later, when I went back and said, why did anybody let me go there? People are like, oh, I had a terrible experience too. And so had I talked to more people about their experience, I probably would have found that name on the list of don't go there. You know what I mean? So I think that's a huge part of it. Are there any questions from our live audience before we wrap it up?
I wanted to know, as a community, what can we do to help women with postpartum depression and mental health issues related to pregnancy? Is there a community group that we can get involved with? Is there a place to donate? Are there social media sites?
So the question for those of you listening online is, what can we do as a community? Where can we get involved? Are there specific places we can donate to? Are there specific groups we can join? How do we get involved in the community?
And to be honest, I honestly don't know. Use your own voice. Advocate for yourself. If you have friends that are going through it, advocate for your friends. Tell them what you see. Tell them that you care. Let them know that you're there for them, their families. Until we can deal with the disparities in our healthcare system, it's going to be really difficult to get that message through. So we just have to use our voices and be loud and advocate when we can. And I would love to see a group. I would love to see something like that, especially locally. I think that would be really impactful.
And I would venture to say that there are probably local groups that do exist.
Yeah.
I think that there are a lot of these conversations happening in pockets all
Yeah.
over the place, and that there are groups that exist for almost everything. If you
yes.
search, I'm one of those people who search on Facebook random,
Yep.
just type in the word and group, and then all
what
these
happens.
things
Yep.
pop up, and then I find out that there are things happening right here at home that I could be involved in, rather than having to start my own, or whether
yes.
a lot of people are spread thin. You may not have the time to dedicate to being on the board of a group, but you might volunteer with a group. You know what I mean? And so we have a lot of volunteer opportunities with YWCA Dayton. Specifically, we are looking for volunteers to help with our children. So if you're into childcare and into working with children and working with moms, we are looking for volunteers in that space. So you can go to ywcadayton.org and go to our volunteer part of our website. You can find places to volunteer with us in that regard. And then I'm sure that there are other ways to get connected when we look at some of the things happening. Gym City Market has had some conversations monthly with doulas that come out and speak to moms in the community. When you look at Five Rivers and see all of the different things that are happening there, they also have wraparound services for women in maternity, from the beginning to the end, along with having connections to the mental health services and things like that. And so I'm sure that there are opportunities to volunteer, to donate, and to work alongside some of the different things happening in the community. Is there anything you would add to that?
Yeah, I would say one, I have to advocate about our local health department. Has a lot of things going on around maternal and infant health, but also thinking about local churches. There's a lot going on in the church, right? And there are a lot of women and men, but I know specifically a lot of women who want to do something, who want to help out. And they have different pantries, they have different emergency stash supplies for moms and babies to help them get through those times. So we think about, again, these urgent needs that women need. They're not even thinking about their health, but can I get through? But we have to look upstream to this policy development. That's where I'm really headed. My brain is. I'm kind of going off the spectrum a little bit, but I wanted to share this. If you aren't aware of For Kira for Moms, it is a nonprofit organization that was started with Charles Johnson IV. He is actually Judge Hatchett's son, whose wife died from complications due to a C-section. She was in exceptional health and died as a result of that. And so he worked with Congress to start a maternal health act, maternal death act, or preventing maternal death act, that is looking at all different aspects of maternal health. And so I think we just have to look more upstream to see how we can be able to support our moms the best, look at different social groups that are out there advocating for moms in whatever space it is. People just want to come and fellowship, right? And so if that can help a mom's maternal mental space, then that can only be good for them. So I know I kind of went off the grid a little bit with answering the question,
I think
but
that's
just
aligned.
as much social groups
justice
that they can be a
yeah.
part of, understanding that legislature is coming down the pipe to be able to support these moms as well.
And then that also plays a role into us socializing the idea that we need to be a part of the policy change. We need to be a part of those conversations. We need to be writing our legislators. We need to be engaged in the political things that are happening in our own community, because the decisions that we make as citizens of our own community are the decisions that then influence the people who then influence the legislation, who then influence the policy. And so, for example, tomorrow, September 28th, we are having our Why Women Vote discussion for our YW discussion with YWCA Dayton. Tomorrow is National Voter Registration Day. Get registered to vote. We're having this discussion because we're talking about the barriers in legislation for women particularly, and some of these issues pertain to women's health and maternity and infant mortality. And so we have to be talking about getting into the polls, having the conversations there, having these conversations in community, and inviting those people who are going to be on the polls to be in the conversation, to understand the needs of the local community, to understand how often these things impact our women right here. And if we can have those conversations and invite them to those conversations or influence them with these conversations, then that can be a part of the societal change. You know, you're either part of the solution or you're part of the problem. And so if you're going to be a part of the solution, that means now that you know the issues that exist here in your community, then now you're responsible to be an advocate. You're responsible to say something, to do something, to be a part, and to not allow this conversation to be the last that you ever had. And so we thank you so much for being willing to be a part of the solution today. Thank you to Malika and Amy for being a part of our panel today. Thank you to those of you who showed up here in person at Gem City Market to be with us today. We appreciate you for being here despite the pandemic that we are in that makes all of these issues 10 times harder. And we thank you to those of you who have joined us virtually. And we look forward to our next conversation every fourth Monday with Gem City Earth Tones here with YW Mission Moves. Thank you again and have a wonderful night. Bye.